What we do at the AAOE is we come to your state and talk each year about all the changes related to coding. And to find which states we're coming to and the dates, just go to the Academy website, aao.org/coding, and there's links to our schedules. And we always provide the up-to-date information. So I'm glad to be here to talk about 5 action items and resources for coding and billing. But another rule in coding is who is the payer? And one of the rules we talk about is not to take one payer's policy or perceived policy and apply that to all payers. So for example, Medicare has policies, and Blue Cross and Aetna and United Healthcare. And each of those policies may vary. So if we take one policy, for example, Medicare, and we assume that all the commercial payers are going to have that same policy, you might actually receive some denials. So that's another important tip. So our first action tip, number 1, and I think this is probably the most important action tip for you to take home, is to review your local coverage determinations. Local coverage determinations, or LCDs, are provided by your Medicare administrative carrier. They're also called MAC. So each of the regions throughout the country and your specific state has a MAC carrier. And each of these LCDs can vary from state to state. And it's important for you to identify what those policies are. So some examples of policies that you might see would be related to cataract surgery, lesion removals, also OCT. And each of these policies has very specific information for you. Now, at the Academy, we have a quick reference link, ao.org/LCDs. And when you click on that quick link, you will identify each of the MACs, and you'll find the MAC for your state, and be able to quickly identify all the current LCDs for your state. What we find in these policies is they talk about medical necessity indications, and then also the ICD-10 codes that would also support medical necessity. Also, what I find very important are the limitations or frequency edits. Oftentimes we see in these policies how often you can bill, for example, a certain diagnostic testing service. And then also the documentation requirements that support medical necessity. So my number 2 action item for you and resource has to do with mastering modifiers. I feel this is like the number 1 takeaway for coding and reimbursement is to master modifiers. Most often what we find with denials are they surround modifiers and just a misuse of modifiers on claims. And honestly, a lot of the MACs talk about their number 1 denial is related to modifiers. One of the resources I'd like to provide for you is on the Academy store is a 1-hour session online resource regarding modifiers. And you can receive CME credit, and your staff can also use this as a resource as well. Modifiers made easy. The third action item is to recognize global periods. We're talking about those surgical modifiers, and also we're talking about office visit modifiers. We're talking about minor, major surgery. We're talking about global periods. So that's why global periods are important to recognize. So for your top surgical procedures in your practice, identify the global periods, not just for Medicare. We're talking about payer rules. Not all payer rules are the same, but also your commercial and your Medicaid products. Medicare may have global periods, but commercial payers may have different global periods. And I've even been in states where Medicaid has a whole nother different global period. So global periods may vary. My number 4 action item for you today is monitor your comparative billing report. Comparative billing reports can be provided to you by both Medicare, and now we're starting to see a lot of commercial payers send comparative billing reports to providers. And what these are is it's a report of the types of procedures that you use, and then they're comparing you to your peers. And oftentimes they're comparing them to your peers within your state, and then also maybe even perhaps regional or national. And this example on the screen is one that was an ophthalmologist, and it was reviewing the new patient office visits. And in this example, the provider was an outlier for the 99204, which is a level 4 new patient. So they're provided by the insurance company. They're not compared by subspecialty at this time. And they're comparing all of ophthalmology. So perhaps you get this comparative billing report, and you see that you're an outlier in a level 4 new patient. But perhaps you're in a subspecialty that provides a higher level of new patient visit more often than your peers. But it gives you the opportunity to look at all these level 4 visits and do an internal audit to make sure that you're meeting the requirements for that level 4. And finally, number 5 is accessing your coding resources. And at the Academy, there's amazing resources available for you, and I just want to make sure that you know that they're there for you. First of all, on the Academy website, ao.org/coding. And from that link, you can find an amazing amount of articles and resources. We also have a link to ao.org/ICD-10 that provides some of these decision trees that you see here on the right as far as updated ICD-10 codes and how to use those appropriately. There's also coding products that are available for you and even other free materials and articles and resources.